now, let's welcome Cindy Cheatham, the Development Manager for the Novant Health Brunswick Medical Center Foundation. Thanks for coming today, Cindy. It's a pleasure to have you.
Thank you very much, Jen. Happy to be here.
You always talk about fun stuff. Well, tell me a little bit about your background. That's how I always start my shows. I want to learn about my people. So tell us a little bit about your background and what drew you to Novant Health.
Okay. Well, I have been with Novant Health Brunswick Medical Center Foundation for almost 5 years now.
Yeah.
Prior to that, I served on the foundation board.
Right.
And for about 10 years prior to that, I worked in nonprofit health care. And as far as what drew me to Novant, I always wanted to be a nurse. That was kind of my, I know, right? It is. My grandmother was a nurse, and I always wanted to be a nurse, and that was my track when I started college. And after my first semester of biology, I decided I needed another avenue. And so working in this part with philanthropy and fundraising within the healthcare sector, I'm able to help in a very meaningful way, but not cause anyone any harm.
Well, tell me about the purpose of Novant Health Brunswick Medical Center Foundation.
Okay. Well, the purpose of our foundation is to connect our donors and engage our donors with different initiatives and programs that we have here at Novant Health so we can save lives and improve our community. So that's our main focus.
That's your main focus. Yeah. And how about now you're collaborating with the New Hanover Regional Medical Center Foundation, correct?
Yes, and that has been an exciting collaboration. So we're working together really more as a coastal market region to expand services, and I'm very excited about working with New Hanover. We've worked on a couple of different initiatives, so I see great things coming in 2022 and beyond.
Yeah, I think it's good for both of us. I'm so glad that we're now one company.
I do,
and
me too.
we enhance one another.
That's right.
Everybody brings something great to the table. So let's talk about some of your top fundraising initiatives.
Okay.
And I think you have several.
We do. One of our big initiatives right now is around behavioral health. And what's so fascinating and interesting about that program, we started working on this as an initiative pre-COVID, really not knowing how the community and really the world would be affected by what we're doing. But some of the things that we're doing locally here in Brunswick, we want to expand our emergency room space so that we have private space, 4 to 5 patient rooms that are for those behavioral health patients. And behavioral health could mean someone who is suffering with some type of mental issue. It could be an addiction issue. There's just different things. But that's one of the...
And the emergency department as it is, it's just not equipped to deal with behavioral health issues. And so by adding those private rooms, it'll be a better experience for those patients, especially if they have to stay too long.
That's right. That's right.
And then you've got a breast health program, right?
We do. And that is just such important work. We have that program to help women who do not have insurance or who are underinsured, to pay for their mammograms. And I can tell you some of those funds were depleted during 2020 because of COVID. We've got so many communities that actively engage in fundraising for us for that, and they weren't able to have their golf tournaments. We have several other large grantors that were not able to fund anything for us, so that's a huge need. And but I think with the collaboration now with New Hanover, and as we're expanding in the coastal market and expanding our resources, I hope we'll be able to. I know we'll be able to do more. But that's a big initiative is to help with that.
And then there's the prescription assistance.
Yes.
I think that's amazing.
It is amazing. And where I see that is when you have a patient that comes into the hospital and let's say they're being discharged, but they can't see their primary physician for 1 to 2 weeks, but they need that medication coverage. That prescription assistance gives them a voucher so they can take that to the pharmacy and have their prescription until they see their primary. So that's a huge help, especially, you know, if transportation's an issue as well.
It is.
Yeah, exactly.
Before, when you would or discharge a patient and they couldn't get their medication, well, all that effort you put into making them better just kind of went down the drain because then they couldn't get their prescriptions.
That's right.
And so this allows that to them to do that.
Right.
So,
That's right.
well, those are all really important projects, and those are all focusing on our patients.
Yes.
So how about our team members? How can the foundation, or how does the foundation support our team members in times of distress?
Right. Well, we do have what we call an employee emergency fund.
Right.
But we kind of expanded that last year during the COVID crisis, or at the height of the COVID crisis, because we had so many of our team members that maybe their significant other lost employment.
Right.
Or the children were sent home and they needed care. Or they had to go to daycare and they needed funds to help them with that. So we were able to really help in that space. And then the Employee Emergency Fund, I mean, I can think back to when we had Hurricane Florence, for example.
We've had lots of things happen in terms of weather related and stuff where we've been able to help.
Right. And so we had team members that were, you know, didn't have a home or were put without their home when they're having their roof, you know, repaired and whatnot. Or so it's a good thing. It's important for us to take care of our own.
I know that you've received a couple of grants. Let's talk a little bit about those.
Okay.
There was one, the Duke Endowment.
Yes.
And then the Golden Leaf.
I know. Golden Leaf Foundation, we received a grant for a water well. And
that's pretty cool.
I know. I thought it was really neat. We want to make sure that in a time of a hurricane or any other crisis that our water supply is not compromised, because we have to have that for our patients, right? To stay open. So that is something that I'm very excited about, that, you know, going into the hurricane season.
So it's right here on campus.
It's right here on campus. So yeah, I think it's ready to go. And
let's hope we don't have to use it, but
I know,
it's
right?
there if we
I'm glad
need it,
it's
right?
there. I'm glad it's there.
And then one of them was a telehealth or a telepsych program in the middle schools?
Yes, that was the Duke Endowment. That was part of our behavioral health initiative. One of the things that we wanted to do with that, we want to expand into the public schools. And our leaders in the public schools said, you know what, let's target the middle schools first. And that's what we did. And again, this grant was written pre-COVID, not knowing that when the children re-enter.
Now they really need it.
They do, back into the school system, you know, what would be needed. And one of the things that recently they gave us kind of a touch base on how the first 30 days has gone is they have already taken care of students in all 5 middle schools.
That's awesome. And what better place to start than in the school system?
That's right. And we've been able to avert some emergency room visits by doing those telehealth and telepsych visits. So it's been a real positive.
Well, before we wrap up, I know it's getting close it is the end of the year, and oftentimes people are looking for areas to make last-minute donations to, or things like that. So is there a method by which people can make a donation to the foundation?
Absolutely. They can go online, www.supportnovant.org, and you can, of course, look at the different programs that Brunswick has. You can always mail in a donation, but as people are making their year-end donations, we would love to be one of their 3 charities of choice.
Oh, that's awesome. Gosh, that's awesome. Well, Cindy, it's been a pleasure to have you. Thank you so much for coming. And I look forward to having you back and talk about some of your other successes.
Absolutely.
At the foundation.
Absolutely. Thank you.
You're welcome.